Guys, we'll be starting the quiz at 10:15. Some of you have requested to wait a minute. So we'll be starting the quiz at 10:15. Last 2 minutes to join the quiz. All right, let's get started.
Yeah.
Okay. So, guys, welcome to another quiz day. And let's get started. Your first question is: a 45-year-old male undergoes thyroid surgery post-operatively. He develops hoarseness of voice. Injury to which nerve is most likely to cause this?
So a classical clinical question which is often repeated in the exams. So to give a clue, think about the nerve that hugs the inferior thyroid artery. Very close, very vulnerable. Right. Recurrent laryngeal nerve.
Great going, guys. Let's keep up the pace. Moving on to your second question.
Okay, which of the following structure passes posterior to the diaphragm through the aortic hiatus?
Well, it's not alone. It travels with the thoracic duct and esophagus vein.
Nice. You gave the answer.
You don't have to tell them. They think, let them think if it is what it is said.
Let's say everyone should get thoracic duct now.
Let's see.
Okay, 8 of them got that.
See, that's what. All right, guys, be focused. Let's move on. Your third question is: the patient presents with winging of the scapula and difficulty in raising his arm above the head. Which nerve is most likely injured? No more clues, no nothing. This is the unique question.
Yeah, picture someone doing a wall push-up. The wing pops out if this long nerve is gone.
Time is ticking. That's correct. Long thoracic nerve is the answer. Moving on.
Okay, a surgeon accidentally ligates the profunda brachii artery during a procedure on the arm. Which accompanying nerve is most likely at the risk of injury?
This is exactly your PYQ. It's been asked. And if you require a clue, here it is. It winds around a spiral groove, a classic combo injury with mid shaft of humerus fracture. Let's see if we can get this.
Okay, sorry. The answer is radial nerve.
Okay.
Okay, because the question has profunda brachii artery instead of the radial groove, I think you might get confused.
Mm, I think they'll note this point. Remember, guys, it's not over until it's over. The fifth question is: during a carotid end endarterectomy, a surgeon accidentally damages a nerve lying posterior to the carotid artery. The patient later presents with hoarseness of voice and deviation of ulva to the right. Which nerve is most likely injured?
So this cranial nerve exists via the jugular foramen. It, oh yeah, okay, sorry, and supplies most of the palate and larynx. Right, it is vagus nerve. Okay, out of 15 players, we have Aisha leading, followed by Myra, Aditi, Anup, Bhagya, Krishna, Hey, Dr. Rita, SSC, Anka. Okay, here's your sixth question. A patient has loss of sensation over the medial thigh and difficulty ducting. The nerve is most likely injured.
This nerve usually sneaks to the obturator canal and live up to its name. Come on, guys, be focused. We're telling you the answer also somehow. All right, very well done, guys. It's obturator nerve. Moving on. See, the tables are going to keep turning. You've got to be focused. Your seventh question is, a patient suffers a fracture at the surgical neck of the humerus. Which of the following structure is most likely to be injured?
So, to give a clue, this is a short and sweet. Think of a shoulder pads area for sensation.
Let's see if we can get this one right. That's
Okay, the
correct.
right answer was axillary nerve. Yeah. Okay, moving on to the eighth. 32-year-old runner presents with of the foot and sensory loss between the first and second toe. Which nerve is most likely affected?
All right, so the clue is coming up, and the clue is it wraps around the neck of the fibula and it doesn't like the tight plaster.
Okay, most of them got it right, except one.
All right, guys, let's move on. So it's a great going, guys. It's a great going. Let's keep up the pace. All right, so your next question is, during an inguinal hernia repair, a surgeon accidentally injures a nerve lying on the anterior surface of the spermatic cord. The patient later complains of loss of sensation over the anterior scrotum. Which nerve is most likely damaged?
So this nerve is a branch of L1,
That's
and
it.
yeah,
That's it.
okay, they got it. It's an femoral nerve. Oh, sorry, ilioinguinal. My bad. Only two of them have got it.
Hmm. It's okay, guys. If you're missing it out, it's missing it out. Doesn't you still have time to go back to your notes and revise? So it's good.
Okay, a stab wound to the anterior abdominal wall just below and more lateral. to the umbilicus is most likely to injure which of the following structures first?
Well, let's say it's not a muscle, that's for sure, but a vessel running in the rectus sheath, just posterior to the rectus abdominis. I've given you the anatomical relation. Let's see if you can get this. Very well done. It is external oblique aponeurosis. So now we have come into the between of the quiz. We have Bhagya with the longest streak. That's great. Aisha on the leading board. And then Bhagya, followed by Myra. Then we have Krishna. Then we have Aditi, Anup, A, Dr. Thorveet Stark, Naga, LV, SST, Shalini, Newt, UG, and when JJ. Some JJ. Okay. And then PKSM. So great going, guys. Let's keep the pace forward. Moving on to your next question. That is, during a popliteal artery aneurysm repair, a structure lying mostly superficial in the popliteal fossa is at risk of injury. Which of the following is it?
So this is the first thing you will encounter in the fossa, which is thin walled and superficial.
Always on top.
Yeah.
Time is clicking. Few more seconds.
We have mixed answers. So the right answer is tibial nerve.
Your next question is, a stab wound to the left fifth intercostal space at the mid-clavicular line is most likely to injure which structure?
So you're piercing right through the cardiac window.
Mhm.
This is actually an easy question. You should know this.
Left fifth intercostal space at the mid-clavicular line. Injury will be
Yeah.
apex of the heart. That's correct. Let's keep the pace up, guys.
Okay. Uh, Patient presents with loss of pain and temperature sensation over the right side of the face. MRI show a lesion at the level of pons and medulla junction, affecting a cranial nerve. So, which foramen does this nerve normally exit from?
Well, it's a sensory giant with three divisions. It exists through the foramen with a name meaning oval in Latin. Mixed batch of answers. The correct answer is foramen ovale. Very well done. Let's keep moving forward. So your next question is, a 45-year-old man presents with proptosis, meiosis, and enteriosis on the left side of his face following trauma to the neck. Which of the following structures is most likely damaged?
So, to give a clue, follow the sympathetic chain upwards. So, this structure actually rides on the wall of a major artery.
Few more seconds to go.
Yeah, nothing but this is a Horner syndrome, so it will be sympathetic chain.
Great going, guys.
Okay, which of the following structure does not pass through the cavernous sinus but rather lies in close relation to it? I think what we study is very similar.
It runs beside the sinus and it is big mover of the eyeball. Guys, if you have any doubts or anything related to any questions, you can just ask us. All right, so optic nerve is the right answer. Let's move forward. Great going, guys. Great going. So your next question is, a 68-year-old man develops sudden right-sided hemiplegia, Broca's aphasia, and right facial weakness. Which cerebral artery is most likely occluded?
So it supplies the lateral convexity of the brain, especially the language dominant area. So it's right-sided and Broca's area is affected.
Very well
Okay.
done. Great going, guys. Let's keep moving forward.
Okay. A male neonate is born with hypospadiasis. Which of the following embryological processes fail to occur properly?
All right, so the clue is, think of holes that are supposed to fuse on the ventral side of something very specific. Last few seconds.
So the right answer is fusion of urethral folds.
All right, moving on. Tables keep turning. So the next question is, during thyroid development, the thyroid gland descends from the foramen cecum to its final position in the neck. Which of the following structures is a remnant of this migration pathway? They're asking you the remnant of this migration pathway.
Yeah, this is a repeat question from NEET PG 24.
Thyroid arousal duct is the right answer. Very well done. Great going, guys. Let's keep moving forward. Second last question for tonight's quiz.
Okay, which of the following epithelia lines the respiratory tract from nasal cavity to the bronchi?
These cells look like they are stacked, but all touch the basement. Plus, they sweep debris away from its tiny hairs. Let's see if we can get this.
Yeah, right. It's pseudostratified ciliated columnar epithelium.
All right, guys. Great. Moving on to last question for tonight's quiz. And then we finish anatomy. Let's see if we can identify the organ. You can click on the picture and zoom in if you like. Good. Last few seconds. Is it a spleen, kidney, liver, or lymph node? All right.
Okay, this was easy actually. I don't know how they confused it with spleen.
Uh, because I think, yeah, it was easy.
Yeah.
All right.
So
Yeah.
Bhagya is the winner of the quiz today. That is Anat grand finale.
Very
So
congratulations.
yeah, congrats to RTT, Myra, Anup, A, Aisha, Krishna, Naka, Dr. Reed Stark, Shalini, SSD, LV, Neat UG, JJ, and PKSM.
Great going, guys. Great
One
going.
more round of applause.
Yes. Yeah, you can see Bhagya is
So I
holding the
think that
longest
is it.
also.
Yeah, right, right.
Great.
So we have completed anatomy and we are left with one more subject.
That is
So we'll
called
see you in the
physiology.
next session.
Yes.
Yeah,
All right, guys. Stay tuned for more quizzes every night at 10 p.m. only at Juxtamed.